Hello friends, welcome once again to the Gesundheit Kitchen, and once again we're not in a kitchen, but that's all right. We got some great things to talk about. I'm here today with my friend Alison DeVries, who is a dietitian and somebody who does a lot with post-gastrectomy patients, which is super important because not every dietitian knows, what's going on once that's been removed. But tell us a little bit about what you do on a normal daily basis.
Yeah, so I work at a clinic called Atlanta Liver Pancreas Surgical Specialists, but we do lots of GI surgeries, a lot of prophylactic gastrectomies for patients who are genetically at risk for developing gastric cancer. And we'll also do gastrectomies for patients on their cancer journey. So I will meet with patients before surgery, kind of get them prepared from a nutrition perspective to heal efficiently from the surgery and make sure they know what to expect from digestion after the surgery, and then afterwards help them tweak their diet, make sure they feel comfortable with how they should be choosing foods after the surgery and go from there.
Well, I think that's fantastic. You're doing a little bit of prehab there, right?
Oh, definitely. So yeah, that's exactly the word we use too.
I think that is amazing, and that is from really my perspective, that's a newer concept.
Yeah.
I mean, it seems like an aha moment, but really, I have a friend who kind of put it this way, that if you were going to train for a race, you wouldn't train for the race the day after the race.
Correct.
Right?
Yeah.
And so if you're throwing all of this information at someone after they've had a surgery, well, everything is now reactive, right? So they're having to kind of figure out, their whole world is upside down.
Yeah.
And now you're telling them, oh, here's a stack of, of printouts of how you should learn to eat.
They might be weak. There's so much going on. There's no way they're going to retain. And it's really important for our cancer patients also, because they might be coming off of chemo. Before surgery, so already in a weakened state, maybe struggling with side effects from treatment, and they haven't been able to eat well for a while. So starting first with trying to get their strength back, so that they have that wound healing capability beforehand, and then going into the education part too.
Well, and let's talk about it from the structural anatomical side. I mean, digestion is kind of a crazy complex magical system, right? Everything has to kind of happen for a normal, whatever that word means, digestion. So let's talk about just the anatomical changes that are happening and how that can affect digestion.
Yeah, so typically when you eat, you chew your food, digestion starts there in your mouth. Your meal travels through your esophagus into your stomach, where it's ground into smaller pieces. And then there's a valve that connects your stomach to your intestines. That valve is called the pyloric sphincter, and that controls the rate that your stomach empties your food into your intestines.
I think that's a misconception. People just assume that
it goes right on down.
Lunch goes out, or but it's almost like incremental or graduated, amounts coming out.
And there's lots of functions that go into that, lots of hormone feedback, and if you are if your intestines are overloaded, it'll send a message to your stomach, let's slow things down a little bit. But after a gastric surgery, that function is completely gone.
That's right.
So you have to work much harder to pre-digest your food in your mouth, because that grinding capacity is no longer there. But really, most importantly, it's that rate limiting step that can bring people a lot of issues eating after surgery.
Well, and the lack of storage, right? I mean, so in my particular case, I had an esophagectomy and a gastrectomy, which not all patients have, but there's almost a little bit of a relearning how to eat, both sort of physically, structurally, and like you said, that feedback loop now almost has to be a very cognitive. You have to be very mentally aware of how much am I eating.
Yeah,
right?
yeah.
And I have found that I have to limit my portion size with a smaller plate or a smaller bowl.
Absolutely.
Because if it's there, I might go back into the old habit, even 20 years later, of trying to eat everything.
Yeah.
Be polite and be, you didn't finish your, is there something wrong? So we always want to over-accommodate for other people.
Yes.
But you're causing an overload.
Yeah, your body can't take too much at one time. It can cause fullness, it can cause GI issues. So really small, frequent meals and snacks, that's one of the first recommendations we'll get our patients started on.
What, so in the prehab or in those first days afterwards, what kind of advice do you give for people? Is it food journaling? Is it, I mean, like what types of things would you tell the person that's waking up from this, you know?
Yeah, so typically we'll start our patients off on a full liquid diet, pureed soups, puddings with added protein powder, small servings of protein shakes, things like that. Typically we'll say 4 to 8 ounce servings at once,
Right.
but to eat every 2 hours. In the long run, eating that frequently is not always necessary, but that's where we start patients at to allow the GI tract to adapt, kind of get accustomed to more volume slowly as the surgical incision is healing as well.
So there is this sort of discomfort with eating, both physically, like you can have nausea, you can have all of these things which can turn people off to food, right?
Yeah.
The idea of food. And then sometimes you can get this sort of, it's called dumping syndrome or reactive hypoglycemia, where all of a sudden meals can go through you too quickly, you can get weak and shaky. So let's kind of really talk about those issues.
Yeah, so essentially this issue is a function of not having a reservoir, not having that storage capacity from the stomach, and not having a rate controlling step that slows down how quickly foods are let into your intestines. So this issue is referred to as dumping syndrome commonly, but really there's 2 separate issues going on here. The first is more of a GI digestion issue, what we call early dumping syndrome, because it tends to happen about 30 minutes after eating, sometimes even a little bit more quickly. But when foods are emptied so quickly into your intestine because they don't have that rate controlling step, your body tries to always maintain a state of homeostasis.
Right, trying to regulate.
Yeah, always. So to neutralize some of those very concentrated particles, your body will release lots of fluid all at once into your intestine. So that can make your intestine very full. It can make your intestine very tight. A lot of people will experience nausea, sometimes vomiting, but really cramping and very quick, urgent, watery diarrhea, because that fluid kind of flushes everything through your system very quickly.
Yeah, and it actually can pull, from my understanding and from my experience, it actually pulls so much liquid from everywhere that you can get headaches. I mean, because it's pulling it from your brain. You can get increased heart rate because it makes your blood slightly thicker because it's pulling moisture from the blood.
Absolutely, all of those things are very true.
So it's a whole body experience.
A whole body experience, definitely. And then even more so with the second part of this issue, which is what we call late dumping syndrome, or postprandial hypoglycemia or reactive hypoglycemia. Those nutrients are then in your intestine in a very large amount. They have to go somewhere. The next step is for those nutrients to be pulled into your bloodstream. The next step is your body releases a lot of insulin all at once.
Right.
And those glucose particles are then pulled very quickly out of your blood into cells. So you'll see a quick blood sugar spike followed by a very rapid drop in your blood sugar, which can also cause symptoms of shakiness, rapid heart rate, low blood pressure, confusion. Not good.
No, yeah, I get sweaty when that happens too. It's like, again, another whole body. And they use the term crash. It feels like a crash. I mean, it is an absolute, like someone has pulled the floor out from under you. Definitely. It's almost like my hard drive is not recording in those moments too. It's definitely confusing. And it's great that your loved ones need this, your caregivers need this education too, because they need to be able to look out for the signs of it. Because there are times where I feel like I'm not even able to communicate that I'm, I'm crashing. And the quick fix for that, is to try to get your blood sugar back up.
Right.
But in those moments, sometimes that's the last thing you want to do.
Oh, absolutely. Right? And the goal really is to try to prevent those events, because with this reactive hypoglycemia, it's the high blood sugar spike that triggers the cascade of lots of insulin being released and causing the low blood sugar. So the goal is really just to even things out, slow everything down so you don't have those rapid ups and downs.
And that is, quite honestly, something throughout this entire Gesundheit Kitchen series that we've been trying to kind of talk about, because yes, it's what's on the plate, but it's also eating is such a social human component. And so no matter how smart you think you are and how prepared you think you are, you're going to be in those situations where Aunt Rita made her famous lemon cream pie and she's going to, I don't want to say force you to eat it.
Oh, yeah.
Right? But you're going to be like,
the pressure.
Fine, I'm going to do it. And so having that conversation with everybody in the room that it's okay that I don't clean my plate, right?
Yeah,
and
that's important.
Normalizing that, because I still want to enjoy those gatherings and enjoy those actual ephemeral moments of life without having to be the weirdo that like, oh, I can't eat that. But nobody is forcing you to eat anything. You have to learn to self-regulate, and that's a whole separate skill set.
Yeah.
Well, listen, we have so much more to talk about, so we're gonna break this conversation into a couple of things. I really appreciate you being here with us. I kind of a little excited. I have so many things that I want to talk about, and things that I wish I had known.
Yeah.
Coming out. So the fact that you're doing this work, I can't thank you enough for doing it and sharing it with us. So. We will look forward to seeing you on our next installment of the Gesundheit Kitchen. Until then, take care of yourself, be well, and Gesundheit.